So before I leave, I just wanted to ask, what would make my pap smear return abnormal?
An abnormal pap smear is caused by a virus called human papillomavirus, also known as HPV.
Hmm, I've heard of that, but I don't really know much about it.
While this is a sexually transmitted virus, you can get it through skin to skin contact with a sexual partner. Women 20 to 29 years old are most likely to get HPV, as well as those who smoke and those with a problem with their immune system, such as women with HIV.
So I'm at a higher risk because I'm sexually active, I'm 25 years old, and I occasionally smoke.
That's correct. I do have to advise you that smoking is very bad for your health. This is a good time to quit smoking before you have bad health effects.
Yeah, I've been trying to quit. But is it a big deal if I get HPV?
It can be a big deal. HPV can cause a range of problems from harmless warts to precancerous cells. It can even lead to cancer. Your immune system can get rid of some HPV infections on its own, but sometimes HPV can cause precancer or cancer of the cervix, vagina, or vulva, which is more likely with some of the high risk HPV types.
High risk types. What are those?
Some types of HPV are more likely to lead to precancer or cancer. The most worrisome ones are HPV 16 or HPV 18, which will always require some type of follow up.
So how do I know if I have HPV 16 or HPV 18?
We will check for them with your pap smear. That's why it's so important to get one on a regular basis.
Is there any way to prevent getting HPV?
Yes, you can be as safe as possible with your partners. Always use a condom. I heard you say you use it most of the time, but make sure you use it all the time. There is also an HPV vaccine. These shots cover the most common and most dangerous types of HPV. We would have liked you to get this vaccine before you ever had sex, but it's still worthwhile to get it now, as it is approved for women up to age 45.
Okay, let's do the vaccine.
Great, we can do that. We can give you the first dose today, and you'll need the second dose in a month and the third dose in 6 months.
What happens if I do have HPV already?
HPV is very common among women in your age group. If it doesn't go away on its own and it causes precancerous changes in your cervix, there are treatments. Once we have the results, we can decide what is the next best step for you.
Okay, that's a relief. Thank you, Dr. Davis. HPV. It's the reason to screen.